Alright, this is an overview of the musculoskeletal system. So to begin, we're going to discuss components of the musculoskeletal system, which are bones, muscles, joints, and bursae. Bones, remember, are composed of osseous tissue, and there's two types of bones. There's compact bones and spongy bones. Your compact bones are those bones that are hard, dense. They make up the outer layer and the shafts. And then the spongy bone is, it has numerous spaces and it makes up your ends and your center. You have two types of osteoblasts and osteoclasts. Your osteoblasts will make your new bone, whereas your osteoclasts break down your bone tissue. A way to remember that is osteoblasts build bone, and osteoclast consumes bone. The bone has red and yellow marrow. The red marrow produces your red blood cells, and the yellow marrow is made up mostly of fat, which is why it's yellow. The outer covering of your bone contains osteoblasts and blood vessels, and these promote nourishment and formation of new bones. This is called the periosteum. Bones can be variable. You have your long bones, your short bones, your flat bones, and your irregular bones. Then we have muscle. There's three types of muscle. There's skeletal, smooth, and cardiac. In the musculoskeletal system, the only really kind of muscle that we are concerned with is the skeletal muscle. It is voluntary and striated, and it connects to our bones and is consciously controlled. The smooth muscle is non-striated and involuntary. It's found in our hollow organs, like stomach, for example. And then the cardiac muscle is also involuntary, but it's striated, and it is only found in the heart. It's specialized, and it helps pump our blood throughout our body. So, we have tendons, which are strong fibrous cords, and they attach to the skeletal muscle. They attach the skeletal muscle to the bones. Then we have ligaments, which are dense, flexible, and fibrous, and they tie bones to other bones. And then we have our cartilage, which is dense and connective. The cartilage is insensitive to pain because there's no pain receptors. It slowly regenerates and minimally regenerates, and the reason is because there's no nerve innervation. There's three types of cartilage. There's your fibrous cartilage, hyaline cartilage, and elastic cartilage. Your fibrous is symphysis pubis and intervertebral discs. So you know your spine has the intervertebral disc. That's fibrous cartilage. Hyaline cartilage, it articulates bone surfaces, so like ribs to sternum. It's also found in our trachea, bronchi, and nasal septum. And then our elastic cartilage, which is found in our auditory canal, our external ear, and our epiglottis. Our joints are places where two or more bones meet, so like your elbow joint, your knee joint, anything that hinges basically. They help provide range of motion for all of our body parts. And then we have bursae, which are small disc-shaped sacs filled with synovial fluid, and they are located at points of friction around joints. So you have like a shoulder bursae, a knee bursae, and it behaves as cushions to decrease stress on adjacent structures. So how does the musculoskeletal system interact with other body systems? Well, it interacts with the neurological system because it's responsible for coordinating functions of skeleton and muscles. So if you have any neurologic complaint, the musculoskeletal should be assessed as well. The spine, there are many muscles that go to our spine. So anything like back pain, anything that we may think has a neurological component. It might have a musculoskeletal component, so both systems need to be assessed fully. It works with our respiratory system because we use muscles in breathing. So accessory muscles help to increase the ventilation and chest expansion. They also increase our lung size during inspiration. We have intercostal muscles, which help to coordinate our rib movement. Contraction of these intercostal muscles help to assist air movement into our lungs by decreasing the intrathoracic pressure. And then our abdominal muscles also assist with deep breathing. They assist with tachypnea, exercise, coughing, and sneezing. Remember, one of the ways to educate a person with COPD is by abdominal breathing. And abdominal breathing will help the person with COPD to take in more air and to let out more air. Then we have developmental considerations. So with our infants and children, so before an infant is even born, when they're in the womb, a fetus develops the skeletal model of the skeleton by 3 months. They have long bones. Children have long bones that grow in length and diameter. They have more bones at birth because everything hasn't fused together. Their spine is more of a C shape. They have an anterior curve of their neck by 3 to 4 months, and then between 1 year and 18 months, they develop the anterior curve of the lumbar. A woman that's pregnant has increased levels of hormone and increased mobility of joints. Their posture changes, and they might develop lordosis. You see the spine of a pregnant woman goes much further in than a regular spine. And then an aging adult, they start to lose bone mass, bone density, which is osteoporosis. A bone reaches its peak life in 25 to 35 years. And then when they are greater than 40 years of age, their bone matrix, they're losing bone faster than they're forming new bone. So they have more osteoclasts, basically, because they're consuming bones, osteoclasts, than osteoblasts, which are forming bones. The estrogen decreases and their height decreases as well. So what is the relevant medical history that we need to ask? Are there any joint problems? Do you have any issues with mobility? When you're walking, do you experience pain? When you're standing, do you experience pain? Do you have any muscle soreness that isn't related to exercise, basically, just in general muscle soreness? If there's an injury, you want to ask about any joints that are close to the area, if the injury is affecting any joints. How does their occupation affect the musculoskeletal system? How does their occupation affect, or how does their injury affect their occupation? And then any effect on ADLs. The review of systems, is there any joint stiffness, any back pain, any injury to the muscle or joint? Do they have a history of fractures or a history of sprains? Is there any history of bone problems? Are they having or have they ever experienced any neck issues or range of motion issues or any problems with muscles in general? Their risk history and their family history. Have the risk factors, have they ever experienced a fall in the past, which makes them at a higher risk for falls in the future? If there's a family history of osteoporosis, joints, or bone cancer. Then we're going to collect our objective data, so we're going to do our assessment. So you want to inspect and palpate. We need to inspect the upper and lower extremities. We need to inspect every part of the upper and lower extremities. So our shoulder, our forearm, our upper arm, our elbows, our hands, our wrists. You want to see how they move, how they hinge well, if they're contracted. You're going to look at the size and contour, going to look at the skin, if there's any color or edema, masses, deformities. We're going to palpate. We're going to palpate joints, palpate by assessing their muscle strength. We're going to have them pull on us. We're going to pull on them. And we want to do range of motion. We want to see how active they are with range of motion. You're going to assess their gait. You want to have them walk normally. Then you want to have them walk on their heels and then walk on the tips of their feet, because you want to see if they have any gait issues or any balance issues. If the examiner is concerned about carpal tunnel syndrome, they would need to perform the Phelan's test. And the Phelan's test is basically you have your arms out in front of you, and you put your dorsal side of your hands towards each other and have them push those together for a minute. And if there's any tingling or numbness in their hands while they're doing this, then it's positive for medial nerve damage, which is indicative of carpal tunnel. And remember, when you're testing range of motion, that you are testing for adduction, adduction, flexion, extension of each part of the extremity. And then also with the gait, you're testing if they have their gait is stable, if they are able to hinge at the waist. So keep all of those in mind. Review the rubric if you have any questions. All right, and so the next video is going to be on the neuro assessment, which will be so fun. And yeah, I will hope you've enjoyed this, and I will see you tomorrow.